I am a registered nurse at the Tresillian Family Care Centres at Willoughby. One of the common roles that I have is helping families who have toddlers who have sleep and settling problems. So today I'm going to talk to you specifically about toddlers. And first of all, before I start to talk about how to settle toddlers, it's really important to know some sleep facts and what we know about toddlers and what is normal. And then I'll go on to talk to you about what are some sleep problems, what you can do about that, and some support that organisations such as Tresillian Family Care Centres can help provide you should you find you need that support for the challenges of settling some of your toddlers. It's important to know that every child and family are individual, and that an enormous variation between children is their sleep patterns. And it's really important to know that one child the same age as your child next door, for example, may have different sleep patterns to yours, and that could be very normal for that family. Toddlers tend to have sleep cycles of about 30 to 50 minutes, and that will include a rapid eye movement sleep and a non-rapid eye movement sleep. And when they come out of the deep sleep, the non-rapid eye movement sleep, they tend to be quite noisy and restless, and that is quite normal. And that often is a worry for parents because they hear the child become restless at that time. But basically, toddlers do need 12 to 13 hours of sleep in a 24-hour period. And so that 1 to 3 year old child generally will have 1 to 2 days sleeps, depending closer to 1 year of age, and up to the 3 year old would probably just have the one sleep plus about 10 or 11 hours sleep at night. By contrast, if you had a child who was, say, 3 to 6 years of age, they would need around about 10 to 12 hours of sleep. And then the older child, 6 to 9, needs about 9 hours of sleep. So what you can see is that as the child grows, their need for sleep lessens somewhat. And I suppose it's important to know that if your child is generally content throughout the day and happy, playing, quite sociable, you could probably say to yourself that his or her sleep needs are being met. But if they're starting to tire, that was probably the toddler's way of saying, I need a rest. So what are the tired signs that we often need to notice in our toddlers so that we know to let them have a rest? And they could be that the toddler may just become a little bit irritable, or more demanding than perhaps earlier in the day, or overactive. And some toddlers too will what we call disengage. They will tend to want to turn away from when you're trying to engage them. And it's important to notice and respond to that in a responsive way when you see those signs. So one of the things that toddlers also are very good at is knowing a routine. And if you have a routine of sorts, it tends to allow the child to associate that patterns of behaviour that may lead to going to bed or to go to sleep. And so a helpful sleep association is one that's not too complicated, or one that requires the parent to be present to go to sleep. So then what we need to then think of is what is helpful in terms of getting a good bedtime routine. So setting a bedtime is good, usually around about 6 to 6:30 in the evening is good for the 1 to 3 year old toddler. That can be preceded by a bath and cleaning teeth, followed by some wind down activities. And it's really important that that wind down be naturally relaxed and unhurried. And so during that wind down time, it's helpful to dim the lights in a room. So if you've got quite bright down lights or a fluorescent light, it might be helpful to perhaps turn on a lamp to the side or to lower the dimmers. And also to turn off the television in the room if it's on, because it's quite stimulating to young toddlers, and they'd be inclined to be attracted and stimulated by that. And for you to sit quietly with your toddler, perhaps the toddler could be on your knee with a comfort toy, a favourite toy, and read a story to the child. But the important thing is too, throughout this wind down time, that the toddler knows that there's going to be an end and that he or she will be going to bed. So what you can say prior to, say, a story being read, for example, is, after I've read you this story, we're going to go to bed, and Mummy and Daddy will say good night to you and pop you into the cot or to the bed. And so he will learn to expect that. So when the story ends, you can go to the bedroom, or if you read the story in the bedroom, that's fine too. Kiss and say good night, and then you can leave the room. And this should start around 6:30 p.m. and take no longer than 1 hour. So 7 to 7:30, the toddler should be asleep. So that's quite a helpful sort of method of encouraging a good sleep pattern. And it's also important that we be consistent with that sort of routine in the evening, so that the child knows to expect that he or she will be going to sleep. So what is a sleep problem? Well, really it is when parents perceive the child is having difficulty going to sleep, and also frequent waking and or climbing out of the bed. And there are some things that can really help, and that is by changing some of the routines that may be in place, and getting some support if you're finding that you don't know quite what to do about that. And so an organisation like Tresillian Family Care Centres, your early childhood health nurse, may be able to help your daycare cottage. And in order to change your sleep patterns, it's good to make up your mind that you're going to be in a process for, say, 4 to 6 or 8 weeks even for some, in order for the child and yourselves to become confident that the sleep associations have been changed and that the sleep patterns have become more entrenched and you've got improved sleep patterns. And it's good to keep a diary also, so that you can reflect on the progress that you're making. And throughout that time, it's good to be positive and remain calm throughout. So if there is a slight regression on 1 or 2 days, that you remain positive and calm and look at the achievements you've made and the changes you've made thus far. So to remove unhelpful sleep associations and support your child throughout the change, that change, which I will go to in a moment or two, requires repetition and consistency, and that is the key to the success of changing your child's sleep patterns. So you need to look at what's happening in the day and try to keep things pretty much as they are during the day. So don't change what else you do. We can just change the associations for going to sleep. So one of the things we can help is what we call self-settling, which I'll talk to you through in a moment. But we do not use controlled crying or go according to the clock anymore. It's something that has been practiced in the past, but our research supports that we actually respond to our child or the toddler's settling needs. So for the 1 to 3-year-old child, even self-settling involves comforting the child briefly in the bed or the cot before leaving the room. And it requires a consistent day and bedtime routine. That part needs to be the same, that you settle the toddler in the same fashion. A good quiet time before bed, and that you do say good night, and you try to leave the child for a short time. And if the child then sounds like he is calming and going off to sleep, he or she really doesn't need you to go in and attend them again, and the crying should wind down. But if the child does become protest and become unsettled and cry consistently, you need to go in and sponsor that child to calm before you leave the room again. The child needs to learn to trust that you will be there for them, that you can teach them to go off to sleep. And that is a great skill to teach a toddler. So the other part that can help you is in the room a night light and a security toy for the child who is over 1 year of age. There is another option that you can use if that option is difficult, a parental presence. So you can actually stay in the room if you choose to and stay with the child until the child goes to sleep, and then remove yourself. That would normally be an option if the child really was unsettled and found it difficult, and you found it difficult to settle the child off in the previous way of self-settling, as I mentioned earlier. And the third method would be what we call gradual withdrawal, and that means you can stay with the child in the room, perhaps even just sit on a chair until the child goes off to sleep, and then, alternatively, the baby calms and you can move yourself closer to the door and eventually leave the room. Now, that is really a broad overview of some settling practices that are now used to encourage a child to learn to go to sleep, and with consistency in the routine and repetition, they can learn quite quickly. My experience has been that if you commit to doing some settling, the child's having difficulty settling, for example, you could actually do some settling with the support of another family member, or support from a community nurse. And the first 3 to 4 days can be the most challenging, and then you will start to see some gains. But it's the changes you make first before you see the results, and so it does take time. But you need to allow 4 to 8 weeks for you to feel confident, and the child to be really confident in his or her sleeping patterns. But what you should see over a period of time is obviously a progressive improvement. In the community, there are a number of professional organisations that you can access their services to help you with settling issues with your toddler. As I mentioned earlier, I work for the Tresillian Family Care Centres, and we have organisations at Canterbury, the Nepean Hospital at Penrith, and at Willoughby, and we have daycare centres as well, and there's one at Wollstonecraft, and daycare centres attached to the other residential facilities. There are outreach services, so a nurse can come out and visit you in your own home if you are in that particular area. And we also offer an online service now where you can access a child and family health nurse for support online. And also we have a parent helpline, so you can actually phone and get some support. And I think that's crucial too, that if your child is settling normally and everything is going along okay, that is good, but you might like to have that reassurance that you are doing the right things. Or if the settling is challenging, you can get some support. And I can't recommend enough the fact that if you get some support and the reassurance that you're travelling along the right way and working with your settling issues, that will also encourage and help your confidence. I'm actually over on the stall at row I-18, and my colleague Carolyn Flynn is there. She's a child and family health nurse, and we're available all day today to answer any of your specific questions that you may have in relation to toddlers and settling, or any other parenting questions you may have on your minds. So thank you.